With regard to the diagnosis and classification of sarcoma, it's a very challenging issue, a very challenging problem. There are many different types of soft tissue sarcoma. In total, there are probably over 80 different histological diseases. Each of these diseases has its own individual clinical behavior and response to systemic therapy. In addition, sarcomas can affect any part of the body, and this makes their classification very, very challenging. The diagnosis requires an experienced soft tissue or bone sarcoma pathologist, and the diagnosis is usually made on a preoperative biopsy. We also usually perform a scan, an MRI scan of the primary site, and perform other imaging tests to exclude metastatic disease. There are a number of prognostic factors available for patients with localized sarcoma, and there are a number of staging systems as well for patients with localized disease. Grade, tumor grade, is a very important prognostic factor. Histological subtype can also give an indication as to prognosis. The size of the tumor, although there's no perfect staging system, is also generally an indicator of prognosis in sarcoma. With regard to the multidisciplinary care required for patients with localized disease, the fact that these tumors can affect any part of the body means that we need many different surgeons, orthopedic surgeons, general abdominal surgeons, thoracic surgeons, gynecological surgeons, so that they can all use their expertise with regard to the individual primary site. The number of different histological subtypes also makes the diagnosis of these tumors very difficult, requiring experienced pathological input. And in addition, the variety of different anatomic sites and disease presentations means that it's very important to have experienced radiologists. In terms of oncological input, it's also crucial to have experienced radiation and medical oncologists to treat and to manage patients with these rare tumors.